Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and I want to share with you today a couple pieces of information on documentation that may really protect your practice and also help your patients get maximum reimbursement with periodontal therapy. It's really clear. We all understand that things are tightening up with the insurance companies, and we really have to make sure that we are dotting all of our I's and crossing all of our T's. So really fortunate recently, the Inspired Hygiene team got a chance to spend some time one-on-one with Dr. Roy Shelburne. And if you look at Roy Shelburne, SHELBURNE.com, you'll learn all about Dr. Shelburne. He's an expert on documentation and coding, does a lot of work with Dr. Charles Blair's group, and a really, really great resource for you if you're looking for that kind of consulting in your practice. So here's a couple things that he shared with us that you must be doing, and that what we know and what we see is very often do not happen in practice. All right, so one thing is making sure that you are documenting the diagnosis of periodontal disease. So if your patient presents with active periodontal disease, it's important to have that in your clinical note, the specific diagnosis, the severity, and the extent of the disease, right? So it would look something like this. It would say generalized severe periodontal disease, right? And this would be in your clinical notes. Treatment is not appropriate unless there's been a diagnosis made, so that diagnosis must be documented, okay? The other thing that he suggested with your claims on your active therapy is to send an electronic version, attach an electronic version of your clinical notes. And your clinical notes should describe what you saw and what was happening with the patient and why you suggested that type of treatment, why you thought that was necessary. And it will include this diagnosis, right? So attaching your clinical notes to the claim, okay? The other thing that he really suggested that I don't think happens near enough with periodontal patients is photos, is utilizing your photography. So intraoral photos, using your intraoral photos for gingivitis patients, for periotherapy patients, for gross debridement patients, really, really helpful and important in helping patients get reimbursement for these types of procedures, is demonstrating why you did what you did, right? So we know how helpful and important photos are with restorative reimbursement. The same goes for periodontal reimbursement. So these three things are going to, one, help your patients get better reimbursement. Two, when you attach them and identify this right off the bat with that first claim, you're going to save yourself time going back and forth and fighting with the insurance company. And three, you're going to document and protect your practice with making sure that you have a diagnosis that matches the treatment that you recommended. We'd love to hear your comments and questions. Please feel free to comment on our blog. Thank you so much.